This animation illustrates the mechanism of protraction of Tresiba, generic name insulin degludec injection. What is Tresiba? Tresiba is indicated to improve glycemic control in adults with diabetes mellitus. It is not recommended for treating diabetic ketoacidosis. Tresiba is contraindicated during episodes of hypoglycemia and in patients with hypersensitivity to Tresiba or one of its excipients. Never share a Tresiba Flex Touch pen between patients, even if the needle is changed. Sharing poses a risk for transmission of blood-borne pathogens. Monitor blood glucose in all patients treated with insulin. Changes in insulin may affect glycemic control. These changes should be made cautiously and under medical supervision. Adjustments in concomitant oral antidiabetic treatment may be needed. Hypoglycemia is the most common adverse reaction of insulin, including Tresiba, and may be life-threatening. Please see additional important safety information throughout this video. Tresiba is a basal insulin with a duration of action of at least 42 hours, developed by Novo Nordisk. Patients who miss a dose of Tresiba should inject their daily dose during waking hours upon discovering the missed dose, and ensure at least 8 hours between consecutive injections. The duration of action of Tresiba, which provides a glucose-lowering effect lasting at least 42 hours, derives from its specifically engineered molecular structure. In the presence of phenol and zinc, Tresiba exists as soluble and stable dihexamers, each of which consists of 2 hexameric structures, made up of 6 individual insulin monomers within a single hexamer. Following subcutaneous injection, and as phenol diffuses away, the dihexamers assemble to form soluble and stable multihexamers, creating a depot of insulin in the subcutaneous tissue. The formation of multihexamers has been clearly demonstrated in vitro, as shown in this electron micrograph. Prolonged depot release due to multihexamer formation gives Tresiba its long duration of action of at least 42 hours. With the diffusion of zinc, insulin monomers gradually disassociate from the ends of the multihexamers and slowly and continuously exit the subcutaneous depot into the circulation. In the bloodstream, the monomers bind strongly but reversibly to albumin. In primary target tissues, the insulin monomers bind to and activate insulin receptors, triggering cellular changes that promote glucose uptake and utilization. Important safety information continued. Accidental mix-ups between basal insulin products and other insulins, particularly rapid-acting insulins, have been reported. To avoid medication errors, always instruct patients to check the insulin label before each injection. Severe, life-threatening generalized allergy, including anaphylaxis, can occur with insulin products, including Tresiba. As with all insulins, Tresiba use can lead to life-threatening hypokalemia, which then may cause respiratory paralysis, ventricular arrhythmia, and death. Closely monitor potassium levels in patients at risk of hypokalemia and treat if indicated. Fluid retention and heart failure can occur with concomitant use of thiazolidinediones, TZDs, which are PPAR gamma agonists, and insulin, including Tresiba. Patients should be observed for signs and symptoms of heart failure. If heart failure occurs, dosage reduction or discontinuation of the TZD must be considered. Adverse reactions commonly associated with Tresiba are hypoglycemia, allergic reactions, injection site reactions, lipodystrophy, pruritus, rash, edema, and weight gain. Certain drugs may affect glucose metabolism, requiring insulin dose adjustment and close monitoring of blood glucose. The signs and symptoms of hypoglycemia may be reduced or absent in patients taking anti-adrenergic drugs, e.g. beta blockers, clonidine, guanethidine, and reserpine. For more information, please click below for Tresiba prescribing information.